Hi everyone, Dr. Becca Knackstedt. I had an interaction with a patient in clinic the other day that really emphasized the importance of patients advocating for themselves, so I thought it would be an interesting story to discuss on social media. So I had a patient who had a history of breast cancer. She was treated at another institution, and while she was at that institution, she had a different plastic surgeon. She was very interested at that time in a body-based reconstruction, and when she brought this up to her plastic surgeon, he told her that it was too invasive, it was only for patients who had a history of radiation, and she should just choose implants because it's a faster and easier surgery. Interestingly, this surgeon does not offer microsurgical reconstruction as part of his practice, but he really didn't even have an educated discussion with her about her options for that. So the patient went on to have implants, and she had some complications, and she just really didn't like the way that she aesthetically felt. So she came to my clinic basically asking for a second opinion, and she was very interested in autologous reconstruction. She was a great candidate for it, so we discussed it, and we decided that that would be a good option for her sometime in the near future. She was so frustrated because she felt like her surgeon hadn't given all of her options to her at the time of the initial discussion. And it was probably because it wasn't something that this surgeon felt comfortable offering as an option, but that's not a reason to not at least have the discussion with the patient, present the very vague pros and cons, even if you don't truly understand it, and then refer that patient for a second opinion. There are some cases in breast reconstruction that I don't do, but I can still have those discussions with my patients, and if it's something they're interested in, refer them to someone who can offer that form of reconstruction. So what can you do to protect yourself? I know that as a patient, especially if you've just had a diagnosis of cancer, it all sounds so overwhelming. How should you even know what your reconstructive options are? I think that this is where social media can be really helpful. Now, we've talked before about the pros and cons of social media. Not a place to go on and ask questions about medications and when to remove your dressings, but a really great place for you to at least find out vague ideas about what your reconstructive options are. And then you can take those options to your plastic surgeon and say, would I be a candidate for this or this? Why or why not? If that surgeon can't give you a good answer as to why or why not, get a second opinion. And if they think that there is an option for you that they just don't offer, also ask for a second opinion. You have the full right to all of your reconstructive options, even if your initial plastic surgeon doesn't offer that. Have you had an experience like this? What did you do? How did you feel like it was handled? If you've had an experience like this, let me know what happened below.